Hello, namaste, and very warm welcome to you all in my channel Moment with Prasanna. It's been 2 weeks. I have not been able to upload the video, but I'm here today to discuss on a sensitive topic. Before that, just want to say keep yourself hydrated. It's summer, it's a bit hot, especially here in London, and make sure you drink at least 2 liters of water every day to keep yourself hydrated and your skin glowing. Thank you so much for supporting my channel as usual. Please do continue to support, send me your comments. If you'd like me to talk about any particular topic, I'll be more than happy to receive your feedbacks and suggestions. And do not forget to subscribe and share my channel. Now, the topic for this week, like I said, it's sensitive but yet very common, which is depression. Life happens. We all have our own stories, painful stories, sad stories, illnesses, relationship problems, or it could be genetic, it could be anything. But sometimes we don't realize what's going on, and those symptoms we may not be able to pick in time. So if you're depressed, you may feel sad, you may feel hopeless, you may lose interest in those things that normally you enjoy. If these symptoms continues for weeks or months, and it starts to interfere with your daily life, your social life and your family life, then you might have to think, is there any signs of depression? The symptoms of depression can be complex and it can fluctuate widely. Women, they experience higher rate of depression than men, 10% of women as compared to men, which is 6.2%. And it could be because of the hormonal factors, especially in women. Depression can often come on very gradually. So some people, they may not even realize they have symptoms of depression. Sometimes people even get mixed up with grief and depression, and it can be difficult to differentiate as they both share some of the same features. Grief is entirely a natural process of losing someone, and while depression is an illness. People who are grieving, they might find their feeling of sadness and still be able to continue with daily to day life and still enjoy the present moment and then look forward for future. However, in depression, there's a constant feeling of sadness, there's a feeling of hopelessness, there's a feeling of restlessness, and they find it difficult to enjoy anything or be positive about their future. That's the difference between grieving, sadness, or being depressed. Depression doesn't have a single cause. There are many factors that play an increasing role in the risk of depression. Researchers, they have suspected that there are many different causes of depression and it is not always preventable. Factors can contribute to depression, could be coming from the genes, genetics, which is not controllable, your brain chemistry, certain medical condition, regular substance abuse, drug and substance abuse, alcohol, stress, and poor nutrition. If you're not been eating well for a long period of time, and eventually because of lack of all the nutrients in your body, that might even lead to depression. Stressful events. Most people take time to come to terms with stressful events, such as losing someone or relationship breakdown. When these stressful events occur, you risk of becoming sad and eventually depressed if you are increasingly being in that sadness. If you stop seeing your friends and family and try to deal the problem just by yourself, then there is a chance that you might slip in depression. So it's very important whenever you're going through problems, sadness, losing someone, relationship breakdown, it is important that you have your family or friends, that someone you can trust to talk to and vent out. You may be more vulnerable to depression if you have certain personality traits such as constantly feeling of low self-esteem, or maybe you are overly critical of yourself. This may be because of the genes that you might have inherited from your parents or from your early childhood experiences or childhood traumas. Or there could be some family history as well. If someone in your family have a history of depression, such as your parents, sister, your cousins, your grandparents, it's more likely you might also develop depression. Giving birth is another moment when most of the women might slip into depression. We call as postnatal depression. Some women are particularly vulnerable to depression after pregnancy due to the hormonal changes, physical changes in their body, and as well as added responsibility of the new life. That can lead to eventually, after giving birth, into postnatal depression. Another factor could be loneliness. Feeling of loneliness if you start cutting off socially from your family, friends, and start being alone for a long period of time. And if you're the kind of person who doesn't have many friends, that might even lead to depression. When life is getting tough, some people drink too much alcohol or start taking drugs. This can actually result in the spiral of depression. It might help at that very moment, but in long term, eventually people can slip into depression. Forgetting your own sorrows with alcohol and drugs is not recommended at all. Alcohol affects the chemistry of the brain, which even increases the risk of, you may have higher risk of depression if you have long-standing illness such as cancer, heart disease, multiple sclerosis, and even head injury. Now let's talk about depression symptoms in children and teenagers. In younger children, depression symptoms could be they're sad, they're very irritable, they're clingy, they worry, they cry, they have unexplained pain in their body, they do not want to go to school, or you start noticing they're underweight and they're not eating properly. This could be in children. In teenagers, symptoms could be sadness, they're not talking to their friends, they are isolated, they're very closed, emotionally, irritability at home or even at school, feeling negative and having a lot of worthless feeling within themselves, angry, poor performance, not meeting their deadlines, and they might even have a feeling of misunderstood by everybody, could be very sensitive and quickly reacting, and eventually they might slip into the habit of taking drugs and alcohol, or eating or sleeping too much, or even having the thoughts of self-harm and losing interest in their normal activities, avoidance of their family, friends, and all the social interactions. Now, talking about depression symptom in older adults, depression is not a normal part of growing process, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and left untreated in older adults. In older adults, people might feel reluctant to seek help just because of the stigma, social norms, and feeling of being judged and fear of being criticized or judged, not being understood. People may just hide it. Symptoms of depression may be different or less obvious in older adult. In older adult, there might be some memory difficulties, change in their personality, physical aches and pain, fatigue, they're tired all the time, sleeplessness, insomnia, and or for some people it could be too much sleep, and they don't have any interest in their personal relationship, in sex, libido, which is low in sex hormones, often wanting to stay at home rather than going out socializing or doing new things, and eventually having suicidal thinking and feeling, especially in older men. Now, how can we get over depression, or what is the treatment? Treatment for depression usually involves combination of self-help with medicine and therapies, talking therapies, exercise. There is an evidence that exercise can help depression, and it's one of the main treatments for mild depression. If you think you're sad or you're mildly depressed, this is the best form. Join the gym, go for a walk, do swimming, any kind of exercise will instantly elevate your mood. You may be referred to a group exercise class as well, especially if you are receiving any counseling. Talking through your feeling can be very helpful. You could talk to your friend, you could talk to your relative, your parents, your partner, whoever you feel like you want to share what's going on within inside. Or you can even seek help from your doctor or psychological therapy services if you have one in your area. You could try self-help books such as listening to podcasts, YouTube videos, reading books, Taking antidepressant, obviously it has to be prescribed by your doctor. Please do not take any antidepressant just going and buying over the counter. It has its own side effect. Please do take some advice if you're thinking of taking any antidepressant. Mental health teams, you should always speak to mental health teams. We can easily find these days online. If you have severe depression, your doctor may refer you to mental health team who has group of team members such as psychologists, psychiatrists, specialist nurses, occupational therapists. This team, they provide intense specialist talking treatments as well as medicines. Talking treatments could be cognitive behavior therapy. If you're interested, it is very helpful. It aims to help you understand your own thoughts and behavior and how they affect you. So if you're interested, CBT, you can even join your course for yourself. CBT, it recognizes that events in your past that may have shaped you today, how you are behaving, but it concentrates mostly on how you can change the way you think, you feel, and you behave in the present moment. It teaches how to overcome negative thoughts. For example, being able to challenge your own hopeless feelings. So it is quite helpful. Another form of talking therapy is counseling. It helps you to think about your problems that you are going through, that you are experiencing in your life, so you can find new ways to deal with them. So counseling is always helpful. Counselors, they support you in finding solution to the problems, but they do not tell you what to do. You can talk in confidence to your counselor who supports you and offers practical help. When you think that you are depressed, if you notice any of these symptoms which has been going on for weeks and months, it is very important that you seek advice from your doctor or mental health team, or find a therapist or counselor as soon as possible before it is too late. If you are reluctant to see or talk to your friend or any of your loved one, any healthcare professional or any community leader or someone that you can trust, it is very helpful. Please open up to them and share your thoughts and feeling and how you feel. They might be able to guide you and point you, signpost you towards the right direction. Hope you're not in this phase of your life, and I wish everyone to be happy and healthy. If you found this video useful, please do not forget to comment, share, and subscribe my channel. Depression is a huge topic. There are a lot more things I could have said, but I'll continue in my next videos. Thank you so much for watching once again. I'll see you again in my next video. Until then, take care and bye-bye.